Gilbert Burns has suffered a sprained neck, a tear in trapezius and deltoid muscle, and a rupture of acromioclavicular joint. I am Dr. Harun Ilyas, and if you are into mechanics and anatomy of sports injuries, consider subscribing to this channel. So, Gilbert Burns has suffered these injuries against Belal Muhammad, and I would be breaking these injuries down in this video, and I would be taking you step by step so that we could have a great understanding of all the injuries that Gilbert Burns have faced. Gilbert Burns has fought about 2 to 3 times in last couple of months, and according to his latest interview, Gilbert Burns has said that when he was trying to do a down block, he landed on his left shoulder, and all his weight and all Belal Muhammad's weight was on his left shoulder, and this is the moment where Gilbert Burns has suffered all these horrific injuries. And now I would be breaking it down one by one, and I would be talking about how the tear in trapezius and deltoid muscle can result in the dislodging of the vertebra and or the dislocation of the vertebra, and there is also a rupture of AC joint that could also be caused by the tearing of trapezius and deltoid muscle. So let us first have a look what a AC joint is, and before I talk about the AC joint, I have to talk about the clavicle and the scapula. So clavicle is this bone, this beauty bone of our body, and one of the bones that is present in our back adjacent to the spine is called the scapula. And if we see in this picture, we can see that scapula has different parts, and one of its part is called acromion, another is called the coracoid process, and the spine of scapula is also there. And when there is a ligamentous connection between the coracoid and clavicle process, that is called acromioclavicular ligament, and when there is a connection between acromion and clavicle, this is called the acromioclavicular joint, and this is what we would be talking here, and this is the ligament that has been torn by Gilbert Burns in his latest bout versus Belal Muhammad. So now I would be talking about how this tearing of acromioclavicular joint might have occurred, and how the tear in trapezius and deltoid muscle can contribute the rupture of acromioclavicular joint. And as we can see in this picture that deltoid muscle has 3 kinds of fibers: the anterior fibers, the lateral fibers, and the posterior fibers. And the anterior fibers are attached with the clavicle, the lateral fibers are attached with the acromion process, the process of scapula, and the posterior fibers are attached with the spine of scapula. All of these fibers that are attached with clavicle, acromion, and scapula then converge onto deltoid tuberosity on the humerus. Humerus is the bone present in our upper arm. So as I have discussed that anterior fibers are attached to the clavicle while the lateral fibers are attached with the acromion, and if the lateral fibers are pulling the acromion on one side and the anterior fibers are pulling the clavicle on the other side, this could result in the separation of acromioclavicular joint. However, this is a general way to explain this, but there could be multiple factors that could be involved, and if there is a tearing between lateral and anterior fibers, this could also result in the separation of AC joint, as we have seen in the case of Gilbert Burns. So the other injury that we would be discussing here is the tearing of a trapezius muscle, and we would also be talking about how the injury to the trapezius muscle can contribute to the dislocation of vertebra and the rupture of AC joint. So if we can see in this picture, trapezius is a diamond shaped muscle present on our upper back, and it attaches to the spinal tuberosity of C7 to T12 vertebra. This is just the number that is assigned to the vertebra according to their location in the spine, and trapezius is attached from the 7th cervical vertebra to the 12th thoracic vertebra, and apart from that, on the sides it is attached to the clavicle, the lateral process of the clavicle, and the spine and acromion process of scapula. And as we know that Gilbert Burns has suffered a dislocation of C5 and C6 vertebra, we can assume that any tearing or any excessive pressure on trapezius can pull the vertebra from their original position, and as there is another injury of rupture of AC joint, we can also assume that any tearing of trapezius muscle between acromion and the lateral process of clavicle can also result in the rupture of AC joint. Trapezius itself is a huge muscle present in our back, and if it pulls one of the structure present in our back, that could result in its dislocation or the rupture that we have seen in this case of Gilbert Burns. And the last thing that I would be discussing in this video is the rupture of acromioclavicular joint, and we have seen through the interview, we have heard through the interview that Gilbert Burns have suffered a grade 2 and grade 3 tear of acromioclavicular joint, and when there is a grade 1 tear, there is always suspicion that there is a stretching of the ligament. But when we talk about grade 2 tear, we always assume that there are some fibers of the ligament that are being torn, and in the case of grade 3 tear, we always assume there is a complete tear of acromioclavicular joint. And this is it from this video. If you are into content related to sports injuries, consider subscribing to this channel.